and welcome back to our Trainee Spotlight series. I'm Megan Fleming, the Communications and Knowledge Translation Officer at CanPath, and this video series is all about showcasing the trainees, graduate students, and early career researchers who are truly championing population health data and showing us that you really don't have to be a seasoned biostatistician or epidemiologist to use big health data. I am so excited to introduce you to Fatima. She is a MPH candidate in epidemiology, and she was previously a practicum student with us using CanPath data and Ontario Health Study data. Fatima, for anyone who might not know you, could you go over just a little bit about where you're at in your journey with research, with school, with work? Just give everyone a little update who you are before we go into our main questions.
Sure. So my name is Fatima. When I started working with CanPath was through my practicum experience in the summer. So that happens after first year through our Master's of Public Health program in epidemiology. So that's when I first got exposure to CanPath data through the practicum. Where I am currently, I'm just doing other projects with like Women's College Hospital at the moment, and we're looking at how lipoprotein levels vary by race and ethnicity. So that's more cardiovascular research. But it's really cool because it's the same concept of working with big data, but this time it's just a different data set. Yeah.
Okay. So what was your role and what did your day-to-day look like?
Perfect. So my role during my practicum was basically to be a bit of an analysis lead. So what that looked like was we were presented with a research question, was just looking at, do breast cancer outcomes vary by race and ethnicity? And so my job was to go into the data, so the OHS data, run things like descriptives, create a table 1, and then do some other descriptive analyses, so like doing like hazard ratios and just seeing whether or not those breast cancer outcomes varied by race and ethnicity on an Ontario provincial level. What the day-to-day looked like was it initially started with really delving into the literature and seeing what the literature already told us about breast cancer risk factors. So do they already vary by race and ethnicity, and just getting a gauge of what the lay of the land was in the literature at the moment. And then it slowly transitioned into diving deeper, doing data analysis and doing descriptives. And then near the end of my term was just, running some of these models, having a write-up saying what the findings were. But yeah, so day-to-day just looked like a lot of just wrangling the data, honestly. You have to clean it first, you have to get familiar with it, data dictionaries, understanding what a lot of these variables mean. So day-to-day was just really familiarizing myself with those concepts and then slowly but surely just chipping away at it step by step by step.
Okay. So that was your part in this larger project. Can you tell whoever's listening a little bit more about what is OHS? What does OHS stand for, and how did your work fit into this larger project?
For sure. So OHS basically stands for the Ontario Health Study, and what it is a survey, and it's distributed across, obviously, given to all Ontarians, and it's very exhaustive in the sense of you get a lot of information about lifestyle factors, clinical factors, demographic factors, and the way that it fits into, I would say, this research question is that we get a provincial level lay of the land of what risk factors are. So what I mean by risk factors are things like smoking status, alcohol use, all of these things you can find in the OHS because it does such a good job of gauging lifestyle factors, behavioral factors, aside from some of those most clinical measurements like comorbidities. So that's the beauty of using OHS, is that you get those lifestyle factors as well. Right. Yeah,
exactly. And then OHS is one of the regional cohorts within CanPath, the largest regional cohort within CanPath. So that's partly why Fatima's here today and fits into this broader landscape of CanPath and population health data, using population health data as a trainee student or early career researcher. What's one thing that you learned about using population health data or supporting others using population health data that you didn't expect and that surprised you?
For sure. So prior to coming into this practical experience and working with OHS, I had never actually worked with big data. And big data is this concept of having massive amounts of records on participants. And I had never actually gone into that previously and had to do the data cleaning part of it. I had to do the part of, operationalizing a variable or deriving new variables. So that was new for me when working with, this type of data, was because most of the times in the classroom, you're given these clean cut data sets. And I didn't expect to go into the data and learn so much about how to use a data dictionary, how to clean variables, how to derive variables. So that's what really surprised me.
Yeah.
But what also surprised me was the breadth and the depth of big data. You can really derive a lot of new variables. So for example, for one of the risk factors we wanted to look at was how long did someone get a breast cancer diagnosis after their screening? Now that isn't something that exists naturally in the data, but you can actually go in and derive it. So I was really surprised by the functionality and like how much you can operationalize and derive from these previous variables. So I think, yeah, to sum it up, I think the most surprising thing was seeing how functional big data is. And what surprised me was my ability to go in, data clean, and data wrangle, and then see all the different possibilities that you can have. Yeah.
So cool. So even though you hadn't really delved into big data before, from other things that you've done throughout your MPH and through like working with data, there's still so much that you could do and derive from that.
100%, because big data is messy, but it also is so fruitful in like what you can extract from it, what you can learn in answering a research question.
Cool. Yeah. So I feel like we've, in a way, kind of gone over our next question, but in case you have something else to add here, what made Ontario Health Study data valuable and unique for the particular work you were doing?
For sure. So we were looking at, again, just to reiterate, how breast cancer outcomes might vary by race and ethnicity. And Ontario is one of the most diverse provinces and like locations that we have in Canada. And so it was critical. It was crucial to have that, like, you know, Ontario level data, because we wanted to see, can we have participants of different races and ethnicities to actually answer this question? So that was really valuable for the Ontario level data, was because the province itself is so diverse, and it really showed in the actual data itself from OHS.
Okay. Yeah. And then, other than working with big data for the first time, did anything else feel difficult or intimidating when you first started working on this project? And did that evolve in any way over time?
For sure. So again, kind of tying it back to what I learned a little bit when I looked at the data, there's so many different variables in the data set, and sometimes you can get a little bit carried away and you want to explore everything. So sometimes you might go, I want to explore the environmental exposure, I want to explore this, I want to explore that, and then your research question kind of deviates from where you initially started, which is a good learning experience. It's good to have that excitement and, you know, think about that, but that was challenging, was like trying to rein myself in and stay close to a research question. But in a way, it's also a positive, because it just goes to show you how many variables you have in this data set, how many different ways you can answer the same research question. But that was a little bit, I guess, difficult, was like reining myself in a little bit and saying, no, I have to stick to these variables, and I have to kind of turn a blind eye to all of these other awesome variables.
It's so hard to be such a passionate researcher. Why is it so difficult? Okay. And then, okay, this makes sense for our next question then. How did working on this project shape how you think about population health?
Definitely. So although the data was diverse, because we're looking at Ontario level data, there still was underrepresentation. So again, we did have different races and ethnicities, but not to the degree that we would have liked per se. And so again, this got me thinking a little bit more about how we conduct research and how we collect data as well, because it's not necessarily a fault of data collection. It's just a matter of maybe people aren't privy to public health research, the importance of public health research. And maybe that needs to translate into something like, you know, knowledge translation or health promotion that really educates the general population about the importance, so that we start getting a little bit more representation in these data sets, because we do have it, but we would obviously always love more.
So Fatima, what would you tell another early career researcher or trainee or student who was interested in using population health data in their research? Any words of wisdom or advice for them?
For sure. I think my advice would just be, have an open mind. It's going to be messy at first, and it might seem challenging and daunting, but you are more than capable. And once you get into that groove of understanding your data, looking at all the different possibilities with this population level data, it's going to become exciting. And so you need to stick through the uncomfortableness at the beginning, but you'll be glad that you stuck it through at the end.
Yeah. Amazing reflection. Okay, thinking of your future research and career path, how do you see CanPath or Ontario Health Study, or even just population health more broadly, fitting into your future career trajectory?
For sure. So I'm really interested in cardiovascular disease research and other comorbidities like diabetes. And I've always been interested on like what role race and ethnicity actually plays in some of these health outcomes. And so this was such a nice launch board for me because I got to see that, but with breast cancer. And I want to see how I can continue to investigate, racial disparities, but in other other comorbidities and other diseases like cardiovascular disease. So I definitely think I've had some of the groundwork laid, and I do want to continue looking at racial disparities and things like cardiovascular disease next as a future early career researcher.